means inflammation of the uveal tract. So before we go through this inflammatory part, we should know what is the composition of uveal tract. So it is composed of three parts. The uveal tract is composed of three parts: iris, ciliary body, and the choroid. Ciliary body is again composed of two parts: pars plica and pars plana. So these are the three parts of the uveal. Gets constricted, and when it gets constricted, then less amount of light will enter into the eye. And again, you can see the color of the iris, it gives color of the eye. If the iris is of brown color, it means it's the brown colored eye. Briefly, we should know about the functions of the ciliary body. It is responsible for the secretion of the aqueous humour. And we know aqueous humour is important to regulate the intraocular pressure. And the second function of ciliary body is related to accommodation. Ciliary body has zonular fibers which change the shape of the lens and shift the focus of the eye from far to near, which is called accommodation. These are two important functions of ciliary body. Similarly, when we see the functions of the choroid, it is basically vascular structure supplying the outer retina. And if the choroidal blood flow is great, it may lead to warmth of the retina. So choroidal blood flow, which is as great as in any other organ, may also cool and warm the retina. Now we know the three parts of the uveal tract. If there is inflammation of the iris, it is called iritis. Inflammation of the ciliary body is called cyclitis. And the inflammation of the choroid is called choroiditis. So when we see different types of uveitis, we can divide them into four groups: anterior uveitis, posterior uveitis, intermediate uveitis, and pan uveitis. These are the four types of uveitis. This is more important, anterior uveitis. Now the anterior uveitis, it may be either iritis only or it may be iridocyclitis. Iritis means when the inflammation predominantly affects only the iris and the ciliary body is either not involved or is minimally involved. It's called iritis. Iridocyclitis means when the inflammation equally affects both the iris and the anterior part of the ciliary body. The anterior part of the ciliary body is called pars plica. So if pars plica and iris are involved, it means it is iridocyclitis. Second type is called posterior uveitis. Now, what is meant by posterior uveitis? It is the inflammation located behind the vitreous base. And we must know the anatomy of the vitreous base. It is 2 to 4 millimeter area just behind the pars plana of the ciliary body, where the vitreous is firmly attached. Just look into this diagram. You will come to know where is the vitreous base. This is the vitreous base. Here, vitreous is firmly attached to the retina, and if there is inflammation related to this part, is called part of the ciliary body, that is pars plana, and the extreme periphery of the retina. This is intermediate uveitis. And the fourth is pan uveitis. Pan uveitis means inflammation of the entire uveal tract from the iris to the ciliary body and the choroid. All three layers of the uveal tract are inflamed and affected, and the condition is called pan uveitis. Now take one by one causes. Among all three uveitis, anterior uveitis is much more common than other types. So we'll go through important causes of anterior uveitis. About 25% cases of anterior uveitis cause is not known. So this is the category of idiopathic anterior uveitis. Among the causes, among the known causes, viral infections such as herpes zoster is the most common one. Then systemic arthropathies like ankylosing spondylitis, systemic bowel disease like ulcerative colitis, regional ileitis, systemic kidney disease like nephritis. These 5 different types of inflammatory conditions are related to uveitis, which is anterior uveitis. So whenever you get patients of ankylosing spondylitis or some bowel diseases or kidney diseases, you must send this patient to an ophthalmologist for eye examination. So whenever you get these cases, you must examine their eyes as well to exclude the possibility of uveitis. Now the causes of intermediate uveitis. It accounts for 8% of all cases of uveitis. Intermediate uveitis is more common in children and young adults. And there are 2 important causes of intermediate uveitis: sarcoidosis and multiple sclerosis. Now third, posterior uveitis. We have combined the causes of posterior uveitis and pan uveitis because the causes of both conditions are nearly same. So just remember few important causes, and that will complete your posterior and pan uveitis category. The most common cause of pan uveitis or posterior uveitis is toxoplasmosis. Second important causes include systemic infective diseases like AIDS, tuberculosis, syphilis, and leprosy. These systemic infective diseases are related to uveitis, are associated with uveitis. Next is systemic non-infective diseases like sarcoidosis. Fourth, if there is severe injury to the other eye, there may be uveitis in the normal eye. Just understand, there is severe injury to one eye, but uveitis occurs in the other eye, which is the normal one. And this is called sympathetic ophthalmitis. Next, if an eye surgery is performed, there may be uveitis in the post-operative period. And this severe post-operative reaction is called endophthalmitis. Now, we are going through an important cause of posterior uveitis or pan uveitis. In your examination, you get these cases in your Stokes examination or in your the examination PCQs or MCQs. This is the toxoplasmosis is a common parasitic infection which is caused by Toxoplasma gondii. Now, the important feature of this condition is you can recognize it very easily if you examine both eyes, because toxoplasmosis generally affects both eyes. And it is very rare it affects only single eye. You will see chorio-retinal scars at the macula in both eyes. These scars are sharply demarcated, circumscribed, and punched out. Now just look into this fundus photograph. In this photograph, you will see this is the optic disc, this is the macular area, and in the macular area, there is a sharply circumscribed, circular, demarcated, punched out lesion at the macula. And this is a characteristic feature of toxoplasmosis. Next important disease which affects posterior uveal tract is sarcoidosis. It is an idiopathic multisystem granulomatous disease. It affects lungs in 90% cases, affects eyes in 30% cases, while the central nervous system is affected in 5% cases. Now, what are the features in the eye? You will see chorio-retinal granuloma formations in both eyes with pan uveitis. Chorio-retinal granulomatous formations in both eyes with pan uveitis. Now, if you take the X-ray of the lungs, it would be abnormal in 90% cases. Second, if you do a skin test, which is called K-beam test, is also positive in 90% cases. And the third, serum ACE level testing, if this test is carried out, it is raised in 60 to 90% cases. So most important investigation in sarcoidosis is X-ray lungs. Now about sympathetic ophthalmitis. Sympathetic ophthalmitis means one eye is having uveitis and the other eye, which is the normal one, develops pan uveitis. The features are bilateral granulomatous pan uveitis, granuloma formations in the chorio-retinal structure. And this condition occurs after severe penetrating injury with uveal prolapse in one eye. So if there is a history of penetrating eye injury with uveal prolapse, you must be careful that this patient might develop sympathetic ophthalmitis. So the injured eye is called exciting eye, and the normal eye which develops pan uveitis is called sympathizing eye. In 65% cases of sympathetic ophthalmitis, pan uveitis develops between 2 to 12 weeks after initial injury. But in 90% cases of sympathetic ophthalmitis, pan uveitis usually develops within 12 months after initial injury. So within 2 to 12 weeks, in 65% cases, and the 90% cases, they develop Pan Uveitis within 12 months. Now, the prevention of sympathetic ophthalmitis. Once you see the patient has developed sympathetic ophthalmitis in the normal eye, then the extremely damaged and uveal prolapsed eye should be removed within 10 days of injury, because after 2 weeks there is a risk of developing sympathetic ophthalmitis. So before 2 weeks, you must remove extremely damaged eyeball. Next is endophthalmitis. Again, important cause of Pan Uveitis. Endophthalmitis is acute inflammation of the structures in the posterior segment of the eyeball. Posterior segment of the eyeball means all the structures which are located behind the lens. So if you look into the anatomy of the eye, the structures which are located behind the lens are vitreous, retina, and the choroid. So all these structures are severely inflamed and infected, and the condition is called endophthalmitis. But the anterior segment, which is in front of the lens, is mildly affected. So once you get a case of endophthalmitis, you just remember certain principles of management. You must remember these principles of management because they are very important in your examination. They may be asked in your table viva or as a short case or in your examination. First, vitreous step is done to isolate organisms. And the most common organism which is responsible for endophthalmitis is Staphylococcus epidermidis. Just remember this organism. Second step is to put intravitreal injections into the vitreous. Intravitreal antibiotics. That is injections into the vitreous cavity. Third is to put antibiotic drops into the eye. That is intensive topical antibiotics. Initially, you put antibiotic drops every 5 minutes. Then for every 15 minutes, then half hourly. If all these measures fail and the condition has been deteriorated and the vision has been reduced to light perception only, then this patient needs surgical treatment, and the surgery is called vitrectomy. Now come to once again to anterior uveitis. We have already gone through the causes of anterior uveitis. Now about the clinical features of anterior uveitis, acute anterior uveitis. These are the 6 important clinical features of anterior uveitis. Ciliary injection, keratic precipitates, iris nodules, aqueous cells, aqueous flare, and posterior synechia. Take one by one. What is ciliary injection? It is the congestion of the ciliary vessels all around the limbus. limbus is the portion or the junction between the cornea and the sclera. So there is congestion of ciliary vessels around the limbus, and it is violet red in color, not bright red, which is in conjunctivitis, but ciliary injection is violet red in color. Here you can see ciliary injection. Now, this is ciliary injection. If you see the limbus, this is limbus, and these are the vessels, congested vessels all around the limbus. This is ciliary injection, all around the limbus. But the rest of the conjunctiva, you can see it's not very congested. But here, all around the cornea, they are very congested. Second feature is keratic precipitates. Whenever you see the word keratic, kera means cornea. Keratic precipitates are the inflammatory cells which have been deposited on the corneal endothelium. And the cells are lymphocytes, monocytes, macrophages, and neutrophils. These cells are deposited on the corneal endothelium and they form keratic precipitates. Now, if you examine the cornea on slit lamp, you can see these white cells on the endothelium. These are keratic precipitates. With the oblique illumination of the slit lamp, you can see these cells. Third feature, iris nodules. They are the aggregates of macrophages, which are the large mononuclear cells. Now, there are two types of iris nodules. These are the two types, Kopi nodules and Bosaka's nodules. Kopi nodules are small and they are situated at the pupillary border. Bosaka nodules are large and they are situated away from the pupillary border. In your BCQs, these two questions are frequently asked. What are the types of nodules and what is the location? Now, in this diagram, you can see nodules, iris nodules. And these are, I'll show you, these are the nodules, this one. Now, you can see these nodules are fairly large and they are not located at the pupillary margin. This is the pupillary margin and they are away from the pupillary margin. So these are Bosaka's nodules. Fourth clinical feature of anti-uveitis, aqueous cells. Aqueous cells means inflammatory cells in the aqueous. And how will you examine aqueous cells? Through slit lamp. When these cells are present, it means that inflammation is active. So the patient needs treatment. As long as aqueous cells are positive, treatment is continued. Aqueous flare is the turbid appearance of the anterior chamber, and it is due to leakage of the proteins from the damaged iris blood vessels. This leakage of proteins, they accumulated in the anterior chamber. So the anterior chamber becomes turbid. Next clinical feature is posterior synechia. Now there are two types of synechia. One is called anterior and the other is called posterior. Synechia means adhesion. Posterior synechia means adhesion between the iris and the anterior surface of the lens. Anterior synechia means adhesion of the iris with the cornea. So if iris is adherent to the cornea, it's called anterior synechia. If iris is adherent to the lens is called posterior synechiae. When posterior synechiae involve 360-degree around pupil, is called Seclusio Pupillae. Now, if you look into this diagram or photograph, you can see pupil is irregular in shape, is festooned, abnormal shape. Atropine drops were placed in this eye. Pupil has been dilated, but irregularly dilated. And this irregular dilatation or this abnormal shape of the pupil is due to posterior synechiae, because iris is attached to the anterior surface of the lens at different locations. And because of this adhesion, pupil gets distorted. This is a sign of posterior synechiae. Now, in this photograph, you will see Seclusio Pupillae, means iris is attached to the lens all around the pupil. Total adhesion. This is Seclusio Pupillae. Now, the complications of Ant Uveitis. This is very important from your examination point of view. The most important complication is glaucoma. Now, besides glaucoma, other complications of Ant Uveitis, they include band keratopathy, cataract, cyclitic membrane formation, and phthisis bulbi. Now, this is band keratopathy. You can see band-like structures in the cornea due to deposition of calcium. Here you can see cyclitic membrane all over the pupil, covering the pupillary area. This is phthisis bulbi, shrunken eyeball which has no perception of light, totally blind eye, sunken, shrunken eyeball. Now, whenever you get a case of uveitis, you have to carry out certain investigations. But these investigations are not required in every case. So you must know in which patient of uveitis you will require investigations. So investigations are required if there is recurrent uveitis, if there is bilateral uveitis in a patient, if the uveitis is extremely severe, or if there is posterior or pan uveitis. In all these conditions, if you see them, then the patient is investigated. Otherwise, there is no need for any investigation. Now, what investigations will you require? These are the 4 investigations: blood test, urine test, radiological test, and skin test. 4 groups. You will carry out complete blood count. There will be lymphocytosis in tuberculosis. Serum calcium level will be raised in sarcoidosis. Serum ACE level will be raised in sarcoidosis. And you will carry out VDRL and FDA for syphilis. So these are the 4 important blood tests to rule out uveitis. HIV is done for AIDS. Serum immunoglobulin levels are checked, which are raised in toxoplasmosis. PCR is positive in toxoplasmosis, and serum RA factor is raised in rheumatoid arthritis. You will carry out 24-hour urinary calcium level if you suspect a case of sarcoidosis. X-rays are done if you suspect tuberculosis. or sarcoidosis or histoplasmosis or ankylosing spondylitis. In all conditions, you will carry out Xray chest. Skin tests. Now, there are 3 types of skin tests. All of you must be knowing that Monto's test is commonly done for tuberculosis. You will see in duration of more than 10 millimeter. A skin in duration of more than 10 millimeter is highly suspicious of tuberculosis. In this diagram, you can see a skin in duration of about 20 millimeter. Second skin test is called pathergy test, which is done for Behçet's disease. In this test, when you scratch the skin, a pustule is immediately formed. Now you look into this diagram, just scratch the skin and you will see pustules. This is called pathergy test. It is done to exclude Behçet's disease. K-beam test is done for sarcoidosis. In this test, sarcoid granular formation when sarcoid tissue injection is done intradermally. This is sarcoid granuloma formation. Now the treatment of uveitis. Treatment is divided into 4 groups: mydriatics, steroids, immunosuppressive agents, and systemic specific therapy. The first line of treatment, mydriatics. These are the different mydriatics which can be used in uveitis: tropicamide, cyclopentolate, atropine, and phenylephrine drops. Now, why mydriatics are used in uveitis? Mydriatic gives rest to the eyeball by paralyzing ciliary muscle and sphincter pupillae. And also mydriatic prevents posterior synechia formation by pupillary dilatation. These are the 2 reasons for which mydriatics are used. The steroids are the main drugs in the treatment of uveitis. These are the main weapons. They are given as eye drops. They are given as periocular injections, intravitreal injections, and they are also given in the form of oral tablets. So there are 4 routes by which steroids are given in cases of uveitis, depending on the severity of the condition. Next is immunosuppressive group. There are 2 medicines which are used in severe uveitis: cyclosporin, and the dose is 2 to 5 milligram per kilogram body weight, and azathioprine tablets 1 to 3 milligram per kilogram body weight. And the 4th is the specific systemic therapy. It means if uveitis is associated with any systemic disease, then you have to treat their disease. For example, if uveitis is associated with tuberculosis, so in addition to local treatment, you will also prescribe anti-tubercular treatment. Similarly, if uveitis is associated with kidney disease or bowel disease, then you have to treat those systemic conditions. So these are the 4 groups of treatment of uveitis.